All right, you guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham on the West Coast. And I'm with Dr. Tom Gimateo. We do these podcasts every a couple times a month. We call it When Doctors Have No Answers, but Tom is a doctor, multiple doctors. But today's podcast, I want to talk to Tom about this idea of when somebody's dealing with whatever they're dealing with. You could say, physical conditions, chronic fatigue, perimenopausal stuff, chronic pain, all sorts of past trauma, like getting, I see a lot of athletes and people that were athletes that have kind of used their body pretty tough and have gone through a lot of fractures and they just want their body back and their health back and their life back. And there's other people that are just dealing with a lot of inner stuff. We're not robots. We got the mental and emotional stuff we're going through, and of course, all the world stuff that's going on. I got so many people that come in talking about that, and it can affect us on a physical level. And I'm thinking about when I first started with IMT, one thing that attracted me to Dr. Tom and Sharon Gimateo was I just felt like something in me said, I'm going to be okay. Like there's something here for me. And I wasn't even injured or anything at the time. Later, I had a running injury and we got me back from that. But and some other stuff too. Got rid of anxiety and sweaty hand issue and all sorts of stuff. And over the years, my life and my family have gotten very good results, big results from when things go really not so good. So I want to ask Tom about something about anything you want to say about integrative manual therapy. And there's many things that people can do, whether it's acupuncture, and you are an acupuncturist, or chiropractic, and you are a chiropractor, or physical therapy. I know you're a physical therapist, naturopathy, medical doctors, surgery. There's lots of options. And if somebody's dealing with something that's a problem, tell us why. What's the thing with this integrative manual therapy?
Well, integrative manual therapy started in the 80s and 90s, 70s and 80s. And it was a journey of Sharon Weiselfish Gimateo, my previous wife. And in 1992, I joined her. She had a practice in Hartford, Connecticut called Regional Physical Therapy. Her training, she was born in Canada. Her training was actually European physical therapy in the 50s. So in the 60s, she went to Israel as it was forming, and she was trained in the British physical therapy methods. And because her family got ill, they came back and settled in Hartford, Connecticut. And her own journey was she had 3 very ill children. Her son was having allergies and needing injections for allergies ever since for the immune system. Her daughter was premature and had a collapsed lung. So she was put into an oxygen tank for a month, her first month. And at age 5, she was diagnosed with being legally blind and mildly retarded. And it was a mother's passion not to have that happen to her daughter. And she blended all these different types of body work, from physical therapy to chiropractic to acupuncture. And we found some similarities, and then we found some discoveries on what was changing. So that emerged into integrative manual therapy in the 70s and 80s and 90s. And then Sharon and I got married in 1996, and we opened the Connecticut School of Integrative Manual Therapy in 2001. And so that is now 25 years old as a profession recognized by the state of Connecticut. And the last 2 years, I'm shifting that into structural medicine. A few body workers have used the word structural medicine from Rolfing, and I'd like to enhance that and even bring it beyond that piece, because it was just doing some body work and helping change, but the IMT structural medicine and the word holocentesis, bringing the parts, the body's greater than its parts, is to really take the best of all worlds of healing. Not that Western medicine is totally bad. You'd like to have them there when you get in a car accident and have to sew your arm back on your shoulder. So they have some good technology there, but we forgot how to heal in the past.
Yeah. So and it was a mother's love to figure this out for her kids, and her daughter ended up being a highly skilled practitioner. And when I first met you in February 2000, she was right there. And what I saw you guys could do to find and fix up basically chronic conditions that instantly I already knew like I got to know this stuff. And I brought you guys into my clinic 4 times a year or so, and I traveled
Yep.
around once a month. And for 10 years, every month I was with you guys, learning and studying and getting this stuff in. And there was something that just felt like, yeah, this is an answer. And um, yeah, one of the things that I see from clients is like how are you doing this? Like I had a runner guy who's coming to see me, a high schooler, and I'm unable to run, stress fractures and a couple of bones and in his foot. And we checked his range of motion in his hip. It was tight, and there was stuff going on. We were going to work on the whole body to improve him. And I did the bone bruise technique that you showed me on his navicular
Yep.
and his talus, and then we rechecked the way his leg went, pushed through the leg, and that was looser, and the hip was way looser. And he said, "How did you do that?" And so I tried to explain it, but ultimately, it's like this. The idea with it is it's hard to it's I don't know if people really want to know how it works, but more maybe they do, but it's like I don't know how my cell phone works, but I can push the buttons. It's just that it's such a new thing for many people to think that you could put your hands on somebody and find a problem and then correct a thing. And when you
Well,
go ahead,
that's one of the issue. That's one of the issues is that it's not a new thing.
it's
It's
not a new thing. Yeah.
it's what Chinese medicine is based on, which we in the United States call acupuncture. Ayurvedic medicine from Deepak Chopra. Those are 4,000-year-old techniques that have been pushed aside, and because of the United States and the Western philosophies, really put us in a mindset that we could get a pill and take a pill for everything, or we can cut it out. And it's pretty much segregated that part of the world.
Yeah.
One
Yeah.
of the big surprises, Ralph, was when, as I was born and raised in Connecticut, right between Boston and New York. So having Harvard and then Yale and then Columbia down there, we were very, Western medicine, go to your doctor, he'll give you a pill, go to the doctor, it'll cut it out type of thing. That I had what I called the Harvard snoot, that we did the best technology in medicine, and people are still brainwashed. I'm going to go to the best sports doctor so they can fix my shoulder and get me back into competing. But we can do immediate care, but how does that influence us 5, 10, 20 years down the road? Wasn't really taken a look at. So those were the things. And when I went to school in Chicago, the Midwest has a different attitude. Everybody had a chiropractor and a body worker that they went to. Plus, they had their medical doctor for the other things that you needed medicines for. So there was a parallel cooperative feeling that was really forced into a disbelief. So there was a physical, economical between pharmaceutical companies, which were run by the Rockefellers and the Carnegies, now having the names DuPont and Johnson and Johnson and all these things, that there was we don't want touch, we want to make them sore, and we want to just keep them under a pill type of thing. And in 1992, that was really discovered. There was a case, Wilkes versus the AMA, and Dr. Wilkes was a chiropractor, and he pulled up all this prejudice that was created by the AMA to ditch the body work of chiropractic, right? And when I started physical therapy was actually a prescription that the medical doctor prescribed to you, just like oxygen or just like other things that would be covered. And now today we have doctors of physical therapy, and the public has better education, and the science of the research from all the data was saying, so 9 out of 10 times the back pain is a muscle pain. 9 out of 10 times the back pain is a muscle pain. But that 0.1% when it's a cancer, we're going to risk giving them exercise first now before we send them and make sure the doctor reads it first in those processes. So now we have a thing called direct access, and we have a primary care provider that could be anywhere from a physician assistant to a nurse practitioner to a doctor of physical therapy, all these other pieces that are bringing people in
Into the system, a way to help them. Yeah.
and into the licensor. And so I feel the United States has been misguided a little bit because the insurance companies rule how you can see your patients. And
Yeah, yeah. I had to get out of those insurance models just because I didn't want them telling me how to treat my clients. It's like people could still use insurance on their own to get covered if it's reimbursable, but I didn't want to be had to jump through so many hoops just to see people. But it's tough because it's like if somebody can't afford it, it's a tough thing. But there are a lot of self-help things that we can give people too. What would you say is there's so many different kinds of people that I've seen IMT help. You know, you've got the Allie D story, Allie with what happened to her and how she got her health and her life back, and me with I literally got rid of anxiety and sweaty hands, and I quit having teeth cavities. I mean, that's incredible, right? and
yeah,
my
so
running improved, and then I have some people that have been through many different accidents and all sorts of fractures, lived quite a athletic, big life. But they're doing really well now, even in their 70s. One guy even says, I keep him in the game and he doesn't
yeah,
have any pain. You know, he used to have a lot of
so
pain.
it's getting more exciting this year. I was asked to talk to the beauty industry of an electrolysis group where they do hair removal. And my discussion, and this is all under the umbrella of structural medicine and IMT, it's not just your muscle, right? So, hormonal hair growth is an imbalance of the hormones, and Western medicine just gives you, your bioidentical hormones and hopes it's fixed. And I asked the whole group, do you ever ask your clients how do they, when they use the restroom, when they make a bowel movement, how many times do they do that? And they said, no, we never did that. Right. So a healthy functional medicine person should poop have a bowel movement 1 to 2 times a day. So it means that something comes in our mouth in 48 hours, it comes back out the other side in this continuous, nice little stream. And some people believe that their bowel movements are healthy when they do it every 2 weeks or 3 weeks.
Yeah,
And they have
yeah,
stomach cramps and they have bloating. So it was just even bringing education that the food we're eating is bad or the structure that we have is bad during the whole process.
yeah. Like it all fits together. So I'm hoping to reach the people that are dealing with things that haven't been totally resolved. Like I see a lot of runners, and I can think of right now some middle schoolers and high schoolers and a college guy that were out for entire seasons with what was being called hip pain, knee pain, and um and we had to improve and heal the structure of the things in the body, in the pelvis, in the belly, in the gut, and we shifted that, and they got their season back, and they're running back, and see them running around town all the time now, and so it's like if something's not getting well from what they're trying, like people think of physical therapy, well, you're going to strengthen it and stretch it, and chiropractic, you're going to manipulate a joint, and um, acupuncture, you're going to stick a needle in. Um, Structural medicine, it's like this
It's looking at all those pieces plus the physiology together and answering the question. You may have a sore shoulder that may be because you just, pulled it because you were on a chainsaw too much or pushing, doing your gardening. But maybe that sore shoulder on your right side is actually because your gallbladder is having trouble and the shoulder muscles are holding it down and you're trying to overuse it that way.
yeah, yeah,
We've had a story of somebody having a frozen shoulder twice a year that was very easily worked with and then wasn't worked with. And he came back, and one day we found him passed out on the floor, And the whole issue was he was an alcoholic and his liver was so toxic, it showed up as shoulder strain.
Yeah, and you could think of it like this, we're a one-piece bodysuit, and if there's a
Yep.
big restriction here, it's going to limit your shoulder, and you can do a lot to the shoulder, but if it's here and it's your liver, which is here, if you free that up structurally, you can get improvements. Um, well, I'm hoping this reaches the people that have tried a lot of different things for conditions, that haven't been helped, and they might be thinking it's, some sort of I'll just give an example. I think I can give this example. Sometimes, oh, I don't want to make people think, I'm a physical therapist, and people come to me for all sorts of chronic and recurring injuries. I had a guy come in with knee pain, but he had some medical stuff going on, really significant. I won't describe the exact nature of it, but he had even been in the ER the night before, and for the last few months, he was having a very significant medical problem. And structurally, I saw he was very compressed around his diaphragm, and we did the techniques you showed me, the diaphragms and release tensions around the vessels of the heart, and worked on what we call descendant phenomena. And his condition was gone. Like, he left, and his girlfriend even said, "You fixed him in like one visit." And it came back a little, but over the course of a couple of weeks, it was gone. We shifted a couple of things in his diet, actually just one thing, and he's doing really well. So he came in thinking, "I've got this knee problem," but nobody was fixing that. And the problem was farther removed, and it wasn't a bone, joint, or muscle issue. So anything else you want to say as we wrap up? Because I know we're at the top of the hour.
Yep. I would just say, if everything else failed, why don't you give us a call and we can chat about what you have and see how we engage differently than other people.
That
Thanks.
would be great. And then just test it for yourself. That's a great thing. And so I'm going to give Tom's contact information. He's on the West Coast, the East Coast, West Hartford, Connecticut, 860-561-2286. I am, let's see, IMTWellnessCenter.com. I'll put the links everywhere you find this, and let us know what you need. And I'm on the West Coast, RalphHavens.com at Beyond Limits Physical Therapy. Tom, thanks a lot for meeting and doing this podcast every month. It's really great.
Always fun to chat with you, Ralph.
It's so good, man. And let's get out there and live, you guys. And I'll see you all soon. All right, Tom. Good to see you and everybody
Bye.
at Center at IMT Wellness.